Joining me now is Dr. Amish Adalja, a senior scholar at the Johns Hopkins Center for Health Security. Dr. Adalja, let's sort through this. We're just seeing also the Washington Post is reporting that Jeff Zients is going to get on with governors later today and tell them that they're going to get 16% more vaccine as of next week. So the supply chain is going to be worked on and they're going to get more supply to them. I don't know, how that's going to be worked out. But the rollout obviously has a range of problems. We see it all around us. We've seen it here in D.C. as well as in Maryland and Virginia, just here in Louisiana, Florida, every place across the country. What is the biggest problem? Is it a lack of supply? Is it supply chain problems? Holdups at the local level? Is it the federal level?
I think it's all of the above, and it depends upon where you're going. But one of the things is that most vaccination centers don't have predictability. They don't know when they're getting more doses, so that's really stifling their ability to make appointments for people to get vaccinated. And I think this is exactly similar to what happened during the 2009 H1N1 pandemic, where nobody knew when the vaccine was coming, and that caused a lot of logistical problems about setting up vaccine clinics. I think we have to kind of get out of this position where the state governors and the federal government are arguing over what they have and what they don't have. And it has to be completely transparent that everybody should know what they have, how much is in the freezer, how much they give, so that we can actually look at this and analyze it. Because right now it's impossible to know. It's almost, a governor says this, the federal government says something different, and then you don't know which one is true. And it seems to be different everywhere you look. But clearly this is failing and this is unacceptable, and they have to fix it because that's the only way we get through this pandemic.
What are you expecting from Moderna now that they've said that they can very quickly produce a booster that will deal with the South African variant and that other variants are responsive to their vaccine?
So this is really good news, and this really speaks to the elegance of the mRNA vaccine platform that Moderna used, that it can be easily adapted. Hopefully it doesn't come to the need of a booster shot that's different than the original vaccine, but this is how we can quickly update it. And I think this is one of the lessons of this pandemic, is that these new vaccine platforms used by Pfizer and Moderna are going to change the way we face emerging infectious diseases in the future. And I do think that doing this ahead of time, to have boosters ready that are altered, is important. But again, it looks like all the data shows that our vaccines are going to be robust enough against these new variants, so we won't ever have to use them. But it's good to know that we have a solution if one is needed.
And Johnson & Johnson is certainly signaling progress, that they may be releasing their trial results next week. Maybe they're going to be ready to ask for emergency use authorization, and that's a single-dose vaccine that does not require extreme refrigeration.
That's going to be very, very important, because right now we have all of this worry about second doses and second dose spacing and mixed matching, giving Moderna after Pfizer or Pfizer versus Moderna. All of that evaporates if you've got a single dose vaccine. The fact also is that if you have a vaccine that doesn't have stringent storage requirements, you can bring this closer to patients. You can bring it closer to people who need vaccinated. You can use refrigerators in doctors' offices. You can use drugstores. You can have mass vaccination clinics very easily with the Johnson & Johnson vaccine without this cold chain. So I do think this is something that we need to have as rapidly as possible. I'm looking forward to the phase 3 data and hope that it looks good, so that we get a quick emergency use approval and have it rolled out and added to the ranks of our vaccines.
I want to try to squeeze in one more question before we get that White House briefing. Regeneron saying that its antibody cocktail is effective in preventing COVID-19 symptomatic infection. In their trial, it was 100% reduction of symptomatic infection, 50% reduction in overall rates of infection. This doesn't replace vaccines, right? But this is an important therapeutic advance.
Yeah, so it is another tool, and we suspected that the monoclonal antibodies would have that effect, that they could be used prophylactically. The question then is a concept of how to use them. Do you go to nursing homes that don't have vaccinated individuals there and basically blanket the nursing home with people with monoclonal antibodies or high-risk individuals in the community? It's another option, but it's secondary to the vaccine, and I think it would have been great if we would have had this earlier, pre-vaccine, because we could have protected our nursing homes. But now I think it's going to probably have more of a limited role, just like we've seen with its use in outpatient settings as well, because there's just not a good concept for using them as well as they could be. So they kind of get going to sit on a shelf for a while and not necessarily have a place in therapy as much.
And California has been such a hot zone, but they are now lifting their strict stay-at-home orders. Despite these restrictions, the state continues to see a rise in infections. So why lift them now?
I think California is a bit of a mystery to a lot of us. We don't quite understand why they're having such a hard time with cases and hospital capacity, despite having the strictest restrictions in the country. But I wonder if there's a little bit of backfiring going on, that these stay-at-home restrictions are driving people into their homes and transmission is occurring in these private gatherings where people let their guards down. So I think that it is important to try and make sure that your public health measures are guided by the metrics. And if these restrictions aren't doing anything to cases, I think they have to kind of recalibrate and figure out how people are getting infected and then target public health interventions that way.
Thanks so much, Dr. Amish Adalja. Thanks for being with us today.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.